blood count on our lab report, we have a complete metabolic panel. This panel will include testing for kidney function, liver function, and electrolytes. Let's take a look at this lab report and the individual parameters. First, under complete metabolic panel, we see glucose. Here the glucose is 93 with a reference range of 65 to 99. That's a fasting blood glucose range. So if the lab work is drawn not fasting or soon after eating, the blood sugar may read higher. The next two tests listed are the BUN and creatinine. The important test here is creatinine, and that's a number that everyone should know. Creatinine measures your kidney function, and on this lab the reference range is 0.57 to 1. Generally, if your creatinine is around 1 or less, that's a normal kidney function. Sometimes as people age, their creatinine will elevate slightly with otherwise normal kidneys. However, that number should not be persistently going up. So again, the trend in creatinine is important. If we draw labs for an annual physical and the creatinine is 1.0, and then a year later it's 1.2, and a year later it's 1.4, that's concerning that the trend is going up. Sometimes you'll see fluctuations. If a person, for example, is very dehydrated, the creatinine might go up, but it should go back down on repeat testing. So if you see a creatinine that's persistently going up, that warrants further evaluation. You should know your creatinine so that over the years when you have lab work you can double check and make sure that that number is staying within normal range, or if you have a baseline slightly elevated creatinine that is not continuing to rise. The other numbers, BUN and EGFR, are also related to kidney function, but for patient purposes I think it's best to just focus on creatinine. So know your creatinine, and if you have questions about the other tests, ask your physician. Also included on this panel are electrolytes like sodium level, potassium, chloride, calcium. You see a carbon dioxide level, which is actually reflecting the bicarbonate in the blood. So these are all electrolyte levels, and they should fall within normal range. Sometimes you'll see them off by, the potassium might be off by 0.5. The sodium level can get low for a lot of different reasons. If people are drinking a lot of fluid or retaining fluid, that sodium level will appear low. If they're dehydrated, the sodium level will appear high. Again, if it's 1 point or so outside of normal range, it's usually not worrisome, but if more than that, it requires evaluation and possibly repeating the lab test. After electrolytes, we see total protein, albumin, globulin. These are measures of the levels of protein in your blood. So normal blood contains some protein. If the levels of protein are low, you get concerned about possible malnutrition. So those are, again, interpreted in context of the total patient. Patients with a lot of chronic health conditions, you'll see abnormal protein or albumin levels, and you really have to look at the total story of the patient to figure out why that is and if anything needs to be done about it. Last on the complete metabolic panel, we see the numbers for total bilirubin, alkaline phosphatase, AST, and ALT. Abnormalities of total bilirubin are most likely associated with some sort of gallbladder or liver disorder. Alkaline phosphatase can be abnormal from various medications as a minor side effect, or from liver or gallbladder disease, also some bone conditions. The majority of the time there's a benign reason for an elevation in the alkaline phosphatase, but again, trend is important and it should be interpreted in context by a primary care physician. AST and ALT are the two tests that most importantly reflect your liver function. They're also abbreviated SGOT or SGPT, and they should be within normal range. Here we see values of 18 and 16. We can see that the normal range is up to around 40 for these two values. They can be elevated for a lot of fairly benign reasons. For example, fatty liver disease is common in people who are overweight, and the majority of patients, that's a minor condition, although it can progress. People who take medications that affect the liver might have an elevation in liver function. People who drink excessive alcohol will have elevated AST or ALT sometimes. So if there's an elevated value, that should be checked and repeated again to see the trend, if it's declining or going up. And if it's persistently elevated, particularly if it's greater than 2 or 3 times the upper limit of normal, it will warrant further evaluation. That completes a discussion of the complete metabolic panel.